I'm just going to check your scalp and your face right now.
Now focus on the head and face. First, inspect and palpate the scalp, hair, and cranium. Also inspect the face, noting its expression and symmetry, which reflect cranial nerve 7 functioning. Next, palpate the temporal artery.
Okay, can you open and close your mouth for me?
And the temporal mandibular joint, as the person opens and closes his mouth.
One more time.
Evaluates cranial nerve 2.
Just going to check your eye.
Next, test extraocular muscle function, assessing for the corneal light reflex in the same spot on both eyes.
Follow my pen with your eyes.
Also test extraocular muscle function by checking for parallel tracking when assessing the 6 cardinal positions of gaze. Remember that extraocular muscle tests evaluate cranial nerves 3, 4, and 6. Inspect the external structures of the eye, including the eyebrows, eyelids, and eyelashes. And then inspect the normally clear conjunctiva and white sclera, as well as each cornea and iris.
Just look right here.
After noting the pupil's size, shape, and equality, darken the room slightly and test the pupillary light reflex. Both pupils should react briskly.
Now I'm going to need you to look at my pen.
Then test for accommodation.
The wall. Okay. Now look at the wall. I need you to look at the wall for me.
After darkening the room a bit more, use an ophthalmoscope to check the red reflex. Then inspect the ocular fundus, including the optic disc, retinal vessels, general background, and macula. With normal room lighting, evaluate the ears. First, inspect the external ears, noting their position, alignment, skin condition, and auditory meatus. Next, move the auricle and push on the tragus to detect any tenderness. Using an otoscope, observe the auditory canal. Also inspect the tympanic membrane, noting its normally pearl gray color, position, landmarks, and integrity.
I need you to put your finger on your right ear and wiggle it slightly.
To assess hearing, begin with the voice test, in which you ask the person to repeat each word after you whisper, "Mother."
I'm going to place this on your head. I just need you to tell me when you hear it.
Next, do the Weber test, in which you place a vibrating tuning fork in the midline on the person's skull.
Behind your ear. I just need you to
Then perform the Rinna test, in which you place a vibrating tuning fork on his mastoid process to test bone conduction, and then near his ear to test air conduction. Now,
Good.
to assess the nose, begin with inspection of the external nose for symmetry and lesions. Then test the patency of each nostril.
Good. Good. I'm just going to look in your nose now.
Using a nasal speculum attached to an otoscope, inspect the nares, including the nasal mucosa, septum, and turbinates. Now focus on the mouth and throat. Using a pen light and tongue blade, inspect the mouth, including the teeth, gums, gag reflex.
Okay. I need you to stick your tongue out for me.
To check cranial nerve 12, ask the person to stick out his tongue. If indicated, put on a glove and bimanually palpate the mouth. To examine the neck, begin by inspecting it for symmetry, lumps, and pulsations. Next, palpate the cervical lymph nodes, including the preauricular, posterior auricular, occipital, submental, submandibular, jugulodigastric, and superficial cervical nodes, deep cervical chain, and posterior cervical and supraclavicular nodes.
Shrug your shoulders, please.
Then inspect and palpate the carotid pulse one side at a time. If indicated, auscultate for carotid bruits.
Take a deep breath in and hold it for me.
Next, palpate the trachea to determine if it is in the midline.
Okay, I just want to check the motion of your neck.
To test range of motion in the neck, have the person tip his head forward and back, turn his head to each side, and shrug his shoulders.
Right. Good. Now shrug your shoulders.
There.
Now we're going to do the same thing, but press against my hand.
To assess muscle strength and test cranial nerve 11, have him repeat these actions against your resistance.
Good.
To prepare for the next few tests, give the person a glass of water, and then step behind him, taking the stethoscope, ruler, and marking pen with you. As he takes sips of water, palpate his thyroid gland.